continue watching Doctors on Call on Family TV and Radio 316. So keep on calling and sending in those SMSs to 4316, and you can call us on 4200 600 because Joanne is in studio picking up your calls. And we are glad that we are joined by Dr. Bridget Monda. Finally, you've made it.
Yes, I have.
We have Dr. Bridget Monda, the gynecologist. So keep those questions coming in. But before we continue with our discussion, we have a panel of, we have a patient story here. And maybe Elizabeth, you can just tell us how you lost your dad.
Yes.
Maybe you can how you coped with the disease.
Okay.
What we did, we had to get a nurse to come and help him towards the final stages because he'd get lost often and hoarding of things. He would pick anything and hide things, like he would keep his money somewhere and then he would start saying we've stolen his money. But he's put it and he cannot remember where he has put it. And he also used to disappear a lot because there's something about Alzheimer's that just wants them to walk. So he would keep leaving the house, so we had to get somebody to keep watching him. And yeah, and then towards the end, he got 2 strokes and he passed on. But it was quite difficult initially to understand what he's going through because he would get lost and would have to keep wondering what's happening to him. He was a very sharp person, and so he would start telling you, there's something wrong with my head, and would keep hitting his head. And towards the end, that's now when we realized what really was the problem. And also the interesting thing, and I was talking to Adia about it, is even in hospitals, when you take them to a hospital, they'll still give them tea and food, and they forget that these people cannot feed themselves. And if we are not there, it's very difficult for them to have somebody taking care of them. Because I remember once he was given tea with a tea bag, and we found him eating he had removed the tea bag, and he was eating it. And other times he went to the police station and said, I am lost. And they asked him in Kiswahili because he was in Mombasa, kama unajua umepotea, umekuja hapa kufanya nini? And you know, because the recent memory is lost. So you can remember in his long-term memory that if you go to a police station, you'll end up getting help. And so he had to sleep under the cars. So those are some of the challenges.
So they didn't even help him?
No, because you see, the other thing we're also talking about is if somebody has Alzheimer's, I've been thinking, and I'm talking to people about it, get a band. Let them have a band on their hand so that it says he's got Alzheimer's, the contacts of the person who can be contacted. Because like for him now, when he could not get the help, he started walking towards Nairobi. He's in Mombasa, and he was found walking because now he doesn't know where he's going. Yeah.
But you've gotten over it now?
Yes, and I talk about it, and I realize when you talk about it, it helps. Yeah, it does.
Doctor, it seems like this disease, when you have it, it's so hard to differentiate, even to tell that actually you're suffering from the disease. Maybe how does it come, and what is it here?
Alzheimer's disease is a disease of the memory. It is one of the dementias we deal with. Dementia meaning that initially the people who are living with you might not even realize that you have a memory problem because it will start slowly. You will put things, keep your keys somewhere and you can't remember where they are. It progresses to the extent where you cannot remember your own children. Sometimes you would give them lunch and they forget they ate, and that too they'll be asking you, why haven't you given us lunch? And you've given them lunch. So it keeps worsening. And with time, actually, the people who really suffer are the caregivers, because this person does not know that might not realize that they have a problem with memory. Again, those who realize, they get depressed because they realize, everybody keeps asking me who they are and I can't remember them, and they realize that this is a problem. So initially they are able to compensate by writing on the diary, but later on they are not able to do that. So it's a chronic disease, and Alzheimer's, there's nothing you can correct, although research is still being done to see whether you can use genes to replace and prevent it, but as of now there's nothing to reverse it. The drugs we give, they actually stabilize the condition, but still it will progress, though it might progress slowly. So again, like one of our speakers have said, the main care is nursing care, where you get a nurse to take care of this person because they need to be guided where they are going. They need to be taken care of. She said that you can give them food and they don't even know they're supposed to eat. You have to remind them, this is food you have to eat. So it's actually a challenging condition. The caregivers need to be supported. They need a lot of counseling to be explained that this is something they are going to live with. It's probably going to worsen, and they should be prepared to either get a nurse or a nurse aide to be able to take care of the patient.
Actually, we need to treat them like babies.
Actually, they become like babies. You have to teach them everything.
And someone is also asking, does hormonal mapping help in discovering any kind of mental imbalance or mental illness? And can one then get cured if a hormonal imbalance is discovered? That's for sure.
Okay, basically, as of today, research is still going on most of the mental illnesses. There are disorders which we are not able to actually, we can tell there's a genetic component like schizophrenia, where you have, if both of your parents have schizophrenia, chances of you getting schizophrenia are 50%, again not 100%. So we are still doing research. We are seeing some have genetic component, but as of today, there's no disease we can actually tell you we can prevent this by doing this hormonal replacement. But again, our drugs, they balance the chemicals. So we use the drugs to balance the chemicals.
Okay.
Can I just say what about Alzheimer's disease? I think the most important thing about Alzheimer's disease is for the doctors to be able to say this is what it is. I think what happens to many of the people who have Alzheimer's disease when they go to see the doctors, they normally don't know where to go. Some of them, they will go to a physician. The physician doesn't give them much. They will go and see a neurologist. They see a neurologist, doesn't give them. Then they see the psychiatrist, and sometimes they have psychiatric manifestations. They can become quite aggressive at times. And when they do, they look like, they're just being stubborn. But the Court of Appeal is that this is a condition that tends to occur in people who are not supposed to be behaving that way. And that's there's something called senile dementia. You're old enough to be stupid. But these are not very, very old people. And sometimes it happens very suddenly. It could be that a man loses a wife. And then suddenly the man who looked okay just goes down. But when he goes down, people still think that he's depressed because the wife died. But as somebody mentioned about the stages, again, those stages are important. But what we've seen is that if you have a person with Alzheimer's disease and you engage their brain closely, meaning you talk to them, but you can imagine an adult in Kitui living with a wife alone there, and the wife is busy and the man is in the house, he's a retired civil servant. What happens in the end? They go down quickly. But if you have them and you engage them, talk to them, ask them with their names, ask them who is the guy you went to school with, so that you keep their brain active. The other thing, a number of these patients tend to have high blood pressure. Now, if the pressure is not controlled, then it seems that the Alzheimer's disease gets worse quickly. So, because they normally have medication and they tend to forget to use the medication, someone must be there to ensure they take their medications. They may also have a problem because when we do the CT scans, what we see, sometimes we find that one portion of the brain is more affected than the other. For example, if the left side is more affected, you can put the food on a plate, and they just eat the food on the right side, and they don't know there's a food on the left side. Again, when you start seeing some of those things, it tells you that now this is the stage you are now. You need to bring in a nurse because. If you get somebody who doesn't know them, then they get very annoyed with them. You're not eating the food, and they become very aggressive. And when you become aggressive with them, then they also become aggressive. But if you understand them and you know that's what is happening, you bring in a nurse who understands them, then you keep them longer. The last thing when they get, I don't know whether they didn't tell you all this, they reach a stage where they will poo and they can play with the poo-poo without knowing this is a poo-poo. They put their hands and they play with it. Now when you find an adult doing that, you don't believe it, but that's what they do. They can actually pass urine and just in the sitting room. But when people see them, they get very annoyed with them. The more you are aggressive with them, the more you take them quickly down. So the trick, getting a nurse before, many nurses are brought in when it's quite late. They bring in just to carry them around. But you can slowly, prevent the progression downwards by bringing a nurse early, a counselor early who keeps talking to them, and also helps the family, because the family suffers. He could actually say that guy was, if it's a lady, say the man is telling me something, and it's not true, and you're going to hate this neighbor who just came to sit next to her. So the family must also understand, the uncles, the extended family must be told what is Alzheimer's disease. Now when you reach at the nursing level, you need things like diapers. They go back to diapers, so you could buy many of them. What tends to kill them, many of them, is they get bed sores and bad infections, and we lose them. But if you give good nursing care, you can keep them for a longer time.
And what's the age bracket? who are most...
Okay, just like Dr. Wafula said, there is senile dementia which is expected to come with age. But with Alzheimer's, it comes early. It's an early dementia. It comes when it's expected. You can even find a 60-year-old getting dementia, Alzheimer's dementia. And the most challenging part of it is to explain to the relatives, the family, that there's nothing you can do to reverse it. You see, they are willing to do any test. You do the test, you exclude. There is nothing in the brain.
But something must have happened, maybe, for it to occur. It can't just come like that.
Okay, majority of it, some of it is genetic in that you might have in the lineup, in the family lineup, probably somebody suffered from it. But again, you see, sometimes you ask relatives whether there was anyone who had dementia, but they tell you there was none. Probably they didn't live old enough to, or probably they didn't go through certain stressors which this particular person is going through. So most of it is genetic, and the most frustrating thing is you cannot reverse it. And it's very frustrating to the relatives that yes, this is happening and there's nothing we can do to reverse it. We can only help with treating the extra symptoms which come. If it's depression, we add treatment for depression. If it's aggression, we give medication for the aggression, and then the rest is nursing care and support for the family.
Okay.
Yes.
So, Daktari, there is someone here who says, hi doctor, what causes excessive bleed during menstrual, especially not having used contraceptives? I'm a single lady, Raro from Nairobi.
Okay, now, what is normal during periods? I'm assuming that's, she gets that excessive bleeding during her periods. What's normal is you lose about 50 to 80 mLs of blood at any one time. That's about 3 to 5 tablespoons of blood in total. Anything more than that is too much. Anything less than that is too little. Now, there are different conditions that can cause that. There are hormonal factors, there are diseases like uterine fibroids, conditions like adenomyosis, certain types of contraceptives as well, particularly the plain progesterone type, hormonal type like the implants, Jadel and Implanon, Depo-Provera, injectables like Noristerat, and yeah, basically those. So the only way she can really know if she really does have a problem is to go in and see a doctor, because then we'd be able to do certain tests and confirm what her problem probably is.
Okay.
Yeah.